Okay, so we'll be concentrating on the general paper. Is that okay? The general paper. So in our previous lecture, we started looking at some concepts in the general paper regarding the licensing exams preparation. So if you remember very well, we spoke about the code of ethics. Is that okay? So specifically, we went through the key areas that frequently they've been asking questions on. So one of the areas is the code of ethics. Okay, so when we say code of ethics, we are looking at set of guiding principles, okay, and then professional standards that direct nurses, how they conduct themselves, how they make decisions, and even their relationship with other patients, and then their own colleagues, as well as how they conduct themselves in society. When we say nurses, we are looking at both curative and then preventive. Is that okay? So when we say code of ethics is more like guiding principles. They are like professional standards. As a nurse, when it comes to professional duty, you are expected to dress in a certain way. All this is because of our code of ethics. As a nurse, there are certain places that when you are in uniform, you can't sit and eat. All that is because of code of ethics. Code of ethics is more like principles that guide how we behave. Is that okay? As a nurse, once you're on professional duty, there are certain things that you may not be allowed to do because of your code of ethics. Do you get it? But then you may not be restricted from doing them when you are not on professional duty. Because of our code of ethics, we even have certain things that, by virtue of the fact that you are a nurse, even if you are not on professional duty, you may not be allowed to do them. Do you get it? Yes, all that is because of our code of ethics. Code of ethics is more like principles. They are like professional standards that direct how nurses conduct themselves, how they make decisions, and how they even relate to patients. So if you're a nurse and you have a problem with, maybe you have anger issues, because of your code of ethics, you can't go to the ward and then communicate with patients and their relatives anyhow because you have anger issues. You have to put that aside and then assume your professional behavior because of our code of ethics. Do you get it? Even how you can't relate with your colleagues in a certain way when you're on a professional duty or when you're on the ward because of our code of ethics. Is that okay? And for code of ethics in Ghana, this is issued by the Nursing and Midwifery Council. Our code of ethics is actually defined by the Nursing and Midwifery. That is the authority that defines code of ethics in Ghana. Is that okay? So the Nursing and Midwifery Council, they provide the ethical guidelines tailored to Ghana's healthcare context regarding nurses that aligns with global nursing standards. So if you look at our code of ethics in Ghana, it's not so different when you are looking at what is done elsewhere, especially in the European countries or in the Western world. Our code of ethics is not. That is the reason why when we travel outside, we are able to fit into their system. Because even though the authority that actually defines our code of ethics is Nursing and Midwifery Council, but then they observe, okay, or whatever guidelines that they institute, they make sure it aligns with the global nursing standards. Is that so? If you look at how nurses behave in Ghana, it's not so different from how nurses conduct themselves when you travel elsewhere. Is that okay? Now, we have an authority or an international body we call the International Council of Nurses Code of Ethics. Okay, so if we are looking at Code of Ethics in Ghana, that one is defined by the Nursing and Midwifery Council. But if we are going international-wise, we have an authority or an international body we call the International Council of Nurses Code of Ethics. And in fact, this International Council of Nurses Code of Ethics, this ICN Code of Ethics, it always comes in the exams. Okay, so this ICN, they are like a global institution. It's like an international body that is recognized for, defining nursing practice, guiding or, structuring a framework that guides nursing practice. In fact, it's an accepted international body that defines, they design framework, like they design standards that international wise, it guides how nurses are supposed to conduct themselves. So if an institution like Nursing and Midwifery Council, if they want to even review some of their standards or some principles, or they want to make some decisions, they usually make references to some of these international bodies. You get International Council of Nurses Code of Ethics. In fact, this International Council of Nurses Code of Ethics, they've actually instituted 4 responsibilities. They named it the 4 fundamental responsibilities of a nurse. So according to them, every nurse, you have 4 fundamental responsibilities. Every nurse, wherever you find yourself in the world, you have 4 fundamental responsibilities. And according to them, the 4 fundamental responsibilities, the first one is to promote health. Is that okay? The second one is to prevent illness. The third one is to restore health. And then the last one is to alleviate suffering. Okay, so according to the International Council of Nurses Code of Ethics, nurses have 4 fundamental responsibilities. Whether you are a public health nurse, whether you are a midwife, whether you are a psychiatric nurse, a general nurse, or any specialty, you have 4 fundamental responsibilities, more like 4 basic responsibilities. And the responsibilities are to promote health. So whatever you are doing as a nurse, your focus should be to encourage the well-being, and then, preventive care, to render preventive care to patients and their families. Okay, your second fundamental responsibility is to prevent illness. Okay, so as a nurse, you always have to take measures to reduce risks and also to reduce the spread of disease. And that is the reason why nurses, we educate patients. You realize that nurses, we educate patients and their relatives, especially when you offer care and patient is being discharged. You educate patients on preventive measures of the condition. You educate the family on how to, prevent future occurrence of that condition. Do you get it? So nurses, we focus. One of the things we do is prevent illness. How do we do that? Through the health education that we give. You get through the community, outreaches that we do. All that is to what? Is to prevent illness from occurring. We also, one of our responsibilities according to them is to restore health. Okay, and if you cast your mind, like the general nurses, what do? They give treatment to patients. Public health nurses, they do vaccinations and other things. You get all that is to restore health to individuals. Okay. Public health nurses visit the homes of patients and their families. Sometimes they treat certain conditions. Sometimes they refer. Do you get it? Some of them they manage. Do you get it? So you realize that basically nurses play a role in restoring health. Okay, and then the last one is to alleviate suffering. Alleviate suffering. Sometimes patients come with several conditions and they come with so many symptoms. Some of them may, go through or experience some kind of discomfort that as a nurse, you may have to put in place measures just to alleviate their suffering, okay, to make sure that they are comfortable. Okay, so basically, as a nurse, one of the things you have to focus on is to alleviate suffering. If a patient is going through pain, your responsibility is to initiate measures to minimize the pain. If a patient is experiencing, let's say, a patient is experiencing maybe abdominal discomfort, it's your responsibility to put in place measures to minimize those, to help patients achieve or attain comfort. Is that okay? So according to this International Council of Nurses Code of Ethics, the responsibility of a nurse is to achieve these 4 basic responsibilities or basic functions: to promote health, prevent illness, restore health, and then alleviate suffering. You have to remember, in fact, you have to memorize it, because all the time they are going to ask you a question on it. Is that okay? Now let's zoom into ethics. Okay, we have these 3 concepts that they always, or sometimes they will ask you questions on. So we have ethics, we have values, and then we have morals. Ethics, values, and morals. Now let's look at the differences between these 3 concepts. When we say ethics, ethics is more like a systematic study of what is right or wrong. So when we say ethics, ethics is more like you trying to understand what is right or wrong. Okay, it's like a systematic study of what is right or wrong, guiding professional and social conduct. Okay, so if I ask you, maybe if you're a nurse, I ask you what are your ethics. Nursing ethics are more like they are principles that actually defines what is right or wrong. That is what we call ethics. Okay, so ethics let us know that, okay, as a nurse, this behavior I'm putting, without ethics, you can't really tell that a behavior is right or wrong. Ethics is more like a concept that makes us know that, oh, okay, someone behave in this way, it is wrong. Someone behave in this way, it is right. It's because of ethics. Is that, for example, it's as a nurse, it's our ethics. Ethics sort of institute. Ethics is not so different from code of ethics. You know, code of ethics are guiding principles. They are guiding professional principles that lets us know how nurses you're expected to take decisions, how you're expected to behave, how you're expected to do things. Do you get it? That is code of ethics. It's just similar to ethics. Ethics let us know that, oh, this is right to do as a nurse, this is wrong to do as a nurse. Okay, this professional conduct is right, this professional conduct is wrong. Yeah, that is ethics. For example, you know, as nurses, it is ethical to uphold patient confidentiality. It's ethical. And as a nurse, it's ethical not to defame your colleague, say something false about your colleague. Do you get it? But then as a nurse, it's unethical. Okay, it's unethical when you defame your colleague, when you go and say something false about them. It's unethical when you don't, you don't keep patient information confidential. It's unethical. Okay, so ethics they are like principles that defines what is right or wrong when it comes to professional conduct. That is ethics. But when we say values are more like beliefs. Values are more like beliefs or ideals that shape behavior and decision making. Realize that every human being, you have values. So there are certain values that you have which I will not consider as my values. Values are like beliefs, things that you believe in. Do you get it? Someone can say that, okay, so as a nurse, maybe we may have what we call reporting time. We may have reporting time. Let's say reporting time is, let's say, 8 a.m. As a nurse, it's your ethics. It's within your ethics that you report to work on time. But you can also, someone can say that, okay, my value is that I report to work 30 minutes before time. It's not ethics, so it's your belief. So someone can have a value that, okay, I'll always report to work 30 minutes before. That doesn't mean it's ethics. Ethics is you going to work the expected time. So the ethics is like the standard. It's like the decision, the rule. It's like the ethics is more like the boundary. Okay. But a value can be something that is outside of the ethics. Okay. So for example, we have some people, they value honesty. We have some people, it's their value that no matter how, they don't lie. Honesty, they are very honest. We have some people that they value compassion. You can take two nurses. One will be very compassionate, the other will not be compassionate. Do you get it? They may all meet their ethical expectations, but then their levels of compassion may be different. Do you get it? So value is like something that you believe in. Some people believe in human dignity. So there are some certain people that you see them, they are very dignified. It's like they have unique ways of doing things, very patient. They try to do things differently all the time, even though they meet the ethical expectations. You get it? So at workplace, you'd notice some people, you realize that all of you are doing what is expected of you, meaning you are adhering to the various ethical principles. But then some people may also go the extra mile. You may notice they have certain values. You get it? Value. And every human being is very important that you have your values. A patient or patients and family can also have their values. Values are like beliefs. You get values are like beliefs. Then we have morals. Morals are personal or cultural standards of right or wrong, often influenced by religion, influenced by tradition, influenced by society. Is that okay? So morals are more like they are personal or cultural standards. You know, some people have their own morals. There are some people, one of their morals is that when they wake up, they will never do anything unless they pray. It's a moral. Usually your morals are influenced by your religion or your tradition. The religion you believe in, your tradition or your society. You know, some people have some morals that they don't eat in public. It's a moral. It could be something the person learns from home. It could be something the person learns from, you know, a culture. It could be something the person learns from religion. Some people have certain morals that they don't believe in certain things. It's like they don't agree to certain things. Okay. So for example, believing it is wrong to steal or lie. That is a moral. Okay. So morals are more like your personal standards. A hospital or a facility or a profession you belong to, they may have ethics. But you yourself as an individual, you have certain morals. Every individual have their own morals aside the hospital or the institutional ethics that they believe in. So morals are like your personal, or sometimes it could be family morals. It could be family morals. Some people come from certain family, they have certain morals that they adhere to, which as they grow, they also learn those morals. Is that okay? So when it comes to morals, they are more like your personal ethics. You get it? Personal ethics. That is the morals. Okay, so now to build on that, let's look at ethical principles. The ethical principles. Okay, so the ethical principles, we will look at 6 ethical principles. Usually in the ethical principles, they ask questions frequently on these 6 ethical principles. So autonomy, beneficence, non-maleficence, justice, fidelity, and then veracity. These are the 6 ethical principles you should expect questions on. They don't go outside of these ethical principles. Is that okay? So autonomy, beneficence, non-maleficence, justice, fidelity, and then veracity. These are the 6 ethical principles. Ethical principles are like, they are more like examples of internationally accepted ethical, standards. You get it? Or ways that we expect that unless you conduct yourself. They are the ethical principles. So for example, one of the ethical principles is autonomy. When we say autonomy is more of respecting or respect for patient choices. You respecting the rights and the choices of patients, the preferences of patients. So if you're a nurse and you respect the choices of patients, the decision of patients, you're observing that ethical principle. For example, you accepting if a patient refuses a certain treatment after you've given all your necessary explanation of the benefits and then the risks involved when they deny that treatment, you still have to respect the choice of the patient. Okay, and that is what we call autonomy. And this is because of this autonomy that we always ensure we get consent, informed consent of patients. Is because of this ethical principle. So they can ask you a question like, okay, a nurse or physicians decide to, perform a procedure for a patient, and the nurse put in place measures to ensure that informed consent is obtained. Then they will ask you a question like, okay, so based on your understanding of ethical principles, which of the ethical principles do you think the nurse is adhering to? This is autonomy. In fact, in a question like that, if you see autonomy and informed consent, they can set a question like that, then the answer, they will bring autonomy, then they will bring informed consent. If you choose informed consent, you are wrong, because informed consent is not an ethical principle. It falls under autonomy. You get it? It falls under autonomy. Okay. Now, another thing you should also remember is that they can ask you a question on confidentiality, a question that it appears more like the scenario is about confidentiality. Then they ask you which of the ethical principles that it falls under. It falls under autonomy. You also keeping patient information confidential comes under autonomy. It comes under autonomy. Okay. It's autonomy is about respect. It's like you are showing respect to the patient. Autonomy. You are showing respect to the patient as an individual person. That is autonomy. Is that so? When we say autonomy, that's the meaning. Autonomy. You respecting the choices and then the personality of the patient. That is autonomy. So if you're a nurse and you are ensuring informed consent has been signed, you are going to do a procedure for a patient. You are seeking the patient's consent. You are trying to explain the treatment, the benefits, the risks. You are trying to explain, to seek permission from the patient before you carry on the procedure. The ethical principle you are observing is autonomy. That is autonomy. Okay, then the next ethical principle is beneficence. Beneficence, promoting patient well-being. Okay, promoting patient well-being. Beneficence is like, as a nurse, always make sure you are doing good. It's like that principle focuses on you doing good to the patient all the time. Okay, so for example, a nurse providing comfort, a nurse administering pain medication. Do you get it? Is beneficence. So in a scenario, if you want to know the answer is beneficence, the scenario should be positive. Please listen on. I'll show you the difference between beneficence and nonfeasance. Very simple for you to know, because sometimes they can use the two to confuse you. Now, if the examiner gives you a scenario, you don't see anything negative in the scenario, it's beneficence. It's like, for example, they tell you that, okay, a nurse is administering pain medication to a patient. Is beneficence. But if they start the scenario from a negative point of view, then the examiner end up saying that, okay, the nurse decided to do something to reverse it. That is non-malfeasance. Do you get it? I'll let you have some examples. We will look at some examples and how you can differentiate between the two. But the key thing is that if you want to know it is beneficence, the scenario shouldn't make any emphasis on something negative. Once the scenario makes emphasis on something negative, the answer is more likely to be non-malfeasance. Please understand the trick. Is that okay? So, for example, let me give you an example. They can give you a scenario like a nurse is going to administer prescribed medications. Then the nurse takes a step to avoid medication errors, to check expiry date of the medication. Do you get it? Once they are emphasizing on the negative side of that procedure, that question, they are talking about non-malfeasance. That's the trick. But then if it is beneficence, you are not going to see any emphasis on a negative statement in the scenario. But for non-malfeasance, the examiner is always going to build on something positive, then an emphasis will be made on something negative. Do you get it? So, for example, let's say a nurse, after giving birth, do you get it, decided to raise bedside rails to prevent patient from falling. You see, there is an emphasis on a negative statement to prevent patient from falling. It's an emphasis to prevent something negative. Do you get it? And when you do that, you are adhering to non-malfeasance. Non-malfeasance means you are avoiding harm, doing things to avoid harm. Do you get it? There is a difference between deciding to do good. Okay, so for example, let's say I decide to administer bedside rail, administer pain medication, or I decide to administer antibiotics to treat patients' infection. It's beneficence. You get it's beneficence. But when I'm going to administer the medication, if I decide to check expiry dates, if I decide to adhere to all the rights of medication just to minimize errors, to do the cross-check and those things to minimize errors, what I'm doing is non-malfeasance. Non-malfeasance is when you are taking actions or measures to minimize or prevent harm. That is non-malfeasance. So anytime they give you the scenario and it's like they are placing a certain emphasis on a step to prevent harm or danger, straight away know they are talking about non-malfeasance. And listen, they would always ask you one question on it, the beneficence and non-malfeasance, because they know it confuses a lot of people. So they always bring one particular question, one on the two, beneficence and non-malfeasance. Okay. The fourth one is justice. Justice simply means being fair. Justice, being fair. So a nurse, you are caring for, you're a Christian nurse, you are caring for a Muslim, a patient who is a Muslim or an Islam. You should, the treatment you give to patient A, irrespective of the background, give the same treatment to patient B. Give the same treatment to patient B. You should be fair in your delivery, even if your parent is on the ward. Okay, and in fact, this justice, a lot of we nurses, we fall short of this justice. Even if your parent is sick on the same ward, the kind of attention that you give to your parents, you should give the same attention to the other patients. That is what we call justice. That is what we call justice. And it turns out that most nurses are not really just. Most nurses, we fall short of this ethical principle, justice. Don't have patients that you like than others. You should like all the patients equally. That is the justice. That's the meaning of justice. Look at it. Fairness and equity in care. Treating patients equally, irrespective of their background. Don't have patients that these are the patients I like. These are the patients that I don't really like. You should treat all patients fairly, irrespective of their background, irrespective of how they even approach you. You should treat all patients fairly. It's a principle that should be at the back of your mind all the time. Then we have what we call fidelity. Fidelity means keeping promise. This ethical principle to, in fact, any nurse, majority nurses that have even done case study before, right from students level, we feel keeping fidelity. The question is, were you fidel with your case study? You tell patient that this case study, you do 3 home visits. Meanwhile, even one you didn't do. Yeah, then you write it in the document. So you see, if you've done case study before, these 2 ethical principles, fidelity and veracity, you fall short of it. Telling the truth, you went to defend. You said you did 3 home visits. Meanwhile, you didn't do any home visit. Veracity. Veracity means telling the truth. Fidelity means keeping promise. You tell patients you come, the patient asks you, okay, what shift are you coming tomorrow? You said, I'm for afternoon shift. Meanwhile, you are off. Do you get it? Meanwhile, you are off. Do you get it? You're in charges, or maybe your colleague asks you, okay, did you give the paracetamol to the patient? You said yes. Meanwhile, you didn't give the medication. Veracity. You should learn to be honest, to tell the truth, being honest. Veracity is different from fidelity. Fidelity means keeping promise. For example, let's say during handing over, afternoon nurses have told you that the patient you are preparing for surgery, you will give a certain medication the night before the surgery. A night nurse, you are taking over from afternoon nurse. You give this medication the night before the surgery. Then you make a promise that, okay, we would give the medication. The next morning we came, you didn't give the medication. You didn't observe fidelity. Fidelity means keeping commitment, keeping your promise, keeping your promise. Do you get? Fidelity means keeping your promise. That is fidelity. Do you get it? Great. So these are the ethical principles that we have in nursing, and they always would quiz you on these ethical principles. Okay, they are very simple principles. So autonomy, beneficence, non-malfeasance, justice, fidelity, and then veracity. Okay, good. So let's look at some examples of these principles. So let's start with autonomy. Look at autonomy. A patient with kidney failure declines dialysis. The nurse respects the decision and supports palliative care. Yes, a patient who is having kidney failure, You've explained to the patient, okay, this is the importance of dialysis. This is the benefits. Okay, these are the complications. The patient still goes ahead and decline. Hey, don't challenge the patient. Start supporting the patient with palliative care, preparing patient to die. That's the only thing you should do. Don't force the patient. Do you get it? Autonomy. Your own is to let the patient understand the benefits of the procedure and then the risks involved. Once you do that, you are done. Respect the patient's decisions. Okay, so a patient with kidney failure declines dialysis. The nurse respects the decision and supports palliative care. That is it. So if they ask you a question like that in the exams, what should the nurse do? What you should do is you should respect the patient's decisions and then you support patient through palliative care. That's all. Okay, let's look at the other question. A nurse provides full information about a surgical procedure so the patient can make an informed choice. That is also autonomy. You see, I was telling you, informed consent also falls under autonomy. So they can give you a scenario like we are preparing a patient for surgery. Is that okay? Then the nurse, you take measures to make sure the procedure, the risks involved, all the details of the procedure have been explained to patients and you obtain informed consent. It comes under autonomy. You don't make choices for patients. That is why even the midwives will tell you when you are doing family planning, you don't make the choice for the patients. You only explain all the family planning methods that we have. Then you guide them to make a choice. You don't make the choice. If you make a choice for them, you are not observing autonomy. You should let them understand, okay, this one, this is how it is used. These are the benefits. Okay, this one, these are the benefits. This one, these are the benefits. These are the side effects. So that the patient willingly makes a choice. That is autonomy. Now let's look at beneficence. A nurse comforts a dying patient. Look at it too. A nurse comforts a dying patient by holding their hand and ensuring they are pain-free. You see how it is? You see, this nurse is doing something good. Did you see something negative? There is nothing negative. Pain-free is positive. Okay, so you realize that the statement is completely positive. So in such a situation is beneficence. Look at the second part of the beneficence. Teaching a hypertensive patient about diet and exercise. You see, the statement is positive. You are teaching a hypertensive patient about diet and exercise to promote health. It's beneficence. Look at non-beneficence. Look, you see what I was telling you. If you want to see in an exams whether the question is non-beneficence, that's the trick. Checking patients' allergies. You see, there is a negative statement. You see, checking patients' allergies before administering antibiotics to avoid harmful reactions. You see, the statement makes emphasis on negative things that the nurse wants to prevent. The statement is making an emphasis on the negative occurrence that the nurse wants to prevent. In such a situation, it's non-malfeasance. So anytime you read the scenario is making an emphasis on a negative occurrence that the nurse you want to prevent. The answer is more likely to be non-malfeasance. Look at the second part. Using proper lifting techniques to safely move a patient and prevent injury. You see, so the statement is making an emphasis on something negative the nurse wants to prevent. In such a situation, it's not malfeasance. That's the difference. Okay, then we have justice. What is justice? Treating all patients in a crowded emergency ward, regardless of race, gender, or income. Do you get it? Treating all patients equally in crowded emergency and ward, regardless of race, gender, income, and even political affiliation or political background. You get, so as a nurse, you should treat all patients equally in crowded emergency ward, regardless of race, gender, or income. Then the second part of justice, look, distributing hospital resources fairly. As a nurse, you've become an in charge. We have night shifts. We have morning duty, afternoon duties. Make sure you distribute resources equally because it's the same ward, the same patients. So justice does not only apply to, so be very mind open, be opened, because sometimes they can frame the question in a certain way. You may go and choose an option, you'll be shocked what the answer is. So justice is not only about treating patients fairly or equally. It also applies to how you even relate to your own colleagues and how you even manage your ward as an in charge. So how you even distribute resources. So you give 9 nurses the glove, you give them half box. Afternoon people, you give them 1 box or sometimes 2 box. Then morning people, you give them 2 box. No, you should be fair in your distribution. You should be very fair. You get it? You have some of your colleagues you like, others you don't like them. Justice. You get it? Justice. Okay? So treating all patients, in fact, treating all your colleagues equally. Justice. Don't have people you like, people you don't like. If you're a nurse like that on a professional grounds, you don't observe ethical principles. You are not ethical. Yeah, you are not ethical. If you're a nurse like that, you are not able to consciously take a decision. You have issues with some of your own colleagues. So you have issue with your professional colleague and you are okay with patients. It's abnormal. You are not ethical as a nurse when you fall in that category. Okay, then we have fidelity. Look at the example. Keeping the promise to update patient family about changes in their condition. You admit patients. On the day of admission, you promise them, you reassure, hey, here we make sure patient is always comfortable. Meanwhile, it's a lie. Even you yourself, you know what you are saying is a lie. That is not what you do. Do you get it? So keeping the promise to update, you tell patient that, oh, whatever changes in the condition, whether patient is recovering or the condition is, regressing, you update them. You don't update. You are not observing fidelity. Then veracity. Veracity is about honestly explaining So, for example, honestly explaining side effects of a medication instead of withholding information. Veracity is that, okay, veracity is telling the truth. Okay, you are going to give a medication to a patient. You know the medication has a certain side effect. You decide that you won't say it. You won't tell. You decide to say something else. And there are some people, this is very common among nurses who sell on the ward. There are some nurses that they know that this medication, patient don't need it. But because of the gains, they want to sell something to them. They will say things that are not even true. They will lie to the patient. Veracity. Let's look at some questions. Then you tell me your answers. Let's look at question 1. Let's look at the question 1. According to the International Council of Nurses Code of Ethics, the fundamental responsibility of a nurse includes A, promoting health. So we have A, promoting health, preventing illness, restoring health, and alleviating suffering. Yes, what do you think will be the answer? Yes, what do you think will be the answer? B, managing hospitals, leading policy reforms and controlling budgets. C, conducting laboratory tests and dispensing drugs. What do you think will be the answer? According to the International Council of Nurses Code of Ethics, what do you think will be the answer? Is it A, B, or C?
A.
Yes, A. The correct answer is A. So this is it. We learned that here. The fundamental responsibility of a nurse is to promote health, prevent illness, restore health, and alleviate suffering. In fact, you have to memorize this before you go in for the exams. Let's look at the second question. Which of the following scenarios best illustrates the principle of non-malfeasance? So you see, let's look at it. A, respecting a patient's decision to refuse surgery. Okay, the A, what principle is that? Respecting patient decision to refuse surgery. What principle? Yes, what principle? Autonomy, yes. Let's look at B. Ensuring equal care is given to all patients in emergency room. What principle is that? Justice. Okay. C. Double checking a medication dosage to avoid patient harm. What principle is that? Non-malfeasance. So you see how you identify. So you see, I told you the non-malfeasance. Check, is there something negative that the nurse is taking an action to prevent? That is non-malfeasance. If you are not careful, you don't understand what I'm saying. You go and choose beneficence and get it wrong. You may think it is beneficence. You get it. So if you want to know it's non-malfeasance, they will always mention something negative that the nurse want to take an action to prevent. That is how you identify that it is non-malfeasance. How about the D? What principle? Being honest with a patient about the side effects of a drug. What is the principle? Yes, veracity. That is veracity. I'm so glad you've understood the principles. Okay, now let's look at some ethical theories in nursing. We have something we call ethical theories in nursing. There are some theories that also sort of define what is right or wrong. When we say ethical theories, they are more like theories that actually defines things that are right or wrong, or things that are expected of nurses and things that are not expected of nurses. We call them ethical theories. Ethical theories. Now we have about 5 ethical theories in nursing. 5 ethical theories. In fact, these 5 ethical theories are the only ethical theories. If they will ask you questions on ethical theories, it will come from these 5. So we have consequentialism, we have deontology, we have teleology, we have utilitarianism, and then the 5th one, we have institutionalism. So we have consequentialism, we have deontology, we have teleology, we have utilitarianism, and then we have institutionalism. These are the ethical theories. There are 5. Now, what is consequentialism? When we say consequentialist, if you say someone is a consequentialist in ethical theories, what it means is that the person defines what is right or wrong based on the outcome. So, for example, if I come to your ward and let's say all the patients are alive, a consequentialist will say that, okay, then you people, you are good nurses. Whether or not you even went to steal one patient's medication and came to give to another patient, at the end of the day, consequentialist is not going to look at the actions you took. Consequentialists only look at the results. Okay, so when we say someone is a consequentialist, they only look at the results to tell that something is right or wrong. So, for example, let's say you are the nurse in charge for maybe 9 shifts. We come in the morning, all your patients are alive. That is the only thing so once all the patients are alive, we will say you are a good nurse, you are right. We judge what is right or wrong based on the outcome. That is a consequentialist. Is that so? For example, let's say a nurse, you went to, let's say, steal patient A painkiller and gave it to patient B, and patient B is now experiencing minimal pain, or patient B is not feeling pain anymore. Consequentialists will judge that nurse to be right. Consequentialists don't look at the actions that were taken. They don't care about the actions. They are just interested in the results. So look at an example. Giving a strong painkiller despite the side effects. So for example, the doctors have requested that, let's say, you give 500 milligrams of analgesic to a patient. The nurse gave 1 gram. Consequentialists don't care. Consequentialists will only come and check. Has the pain been relieved? Once the patient says pain has been relieved, consequentialist is okay. As a nurse, do you think consequentialist is a good thing? Do you think it's a good thing to practice? Do you think it's something good? You don't check the actions. You are only interested in the results, irrespective of what was done to achieve the results. Do you think it's something that is good? Yes, let's analyze, let's discuss. Do you think it is something that is very good to be a consequentialist? Yes. Can you guys hear me?
Yes, sir.
Yes. So I was asking, do you think it is something that is very good?
No.
Yeah, it's not good all the time. Okay, it's not all the time that such a practice will be good. Let's look at the second ethical theory, deontology. Deontology. Okay, deontology is more like duty-based ethics. Okay, so actions are right or wrong regardless of consequences. That is deontology. Okay, so the deontology, that is the duty-based ethics. Deontology does not look at the outcome. Deontology will look at whether you observe ethical principles. So, for example, a nurse, maybe you're on duty, you did what is expected of you. Patients died. Deontology is okay. So, a nurse, let's say you were managing 9 shifts. You observe all ethical principles. You did what is expected of you. Everything you did is right. You observe standard, you observe protocols, you did your document, everything is on point. Do you get it? Irrespective of whether you achieve a negative outcome or a positive outcome, deontology believes that that is the best. That is what we call deontology. So, deontology and consequentialism, which one do you think it is the best? The deontology, they don't judge the results. The deontology will look at the action. Did you do what is right or did you do what is wrong? If you did what is right, deontology believes in that. Even if you did what is right and patient died, or you did what is right and something bad happened, deontology believes that is the best. Deontology and consequentialist, which one do you think is good?
Deontology.
Deontology. Yes, deontology is the best. Keep it in your mind. Deontology is the best. Now we have another, because why is deontology the best? Because deontology believes in ethics. It believes in ethics during duty. Deontology will not come and look at and deontology, we are not saying that you achieve a negative result. What we are saying, the deontologists will not check your results. Deontologists will make sure that what you did, is it right or wrong? Once you did the right thing, even if you achieved a negative result, deontology will declare you to be right. Their own is that, did you observe standards? Did you observe protocols? Did you observe principles, the guidelines when you were taking the action? Once you did it, whether or not your action was positive or negative, deontology would support and declare you to be right. That is deontology. Is that okay? Let's look at the other one, teleology. Now, teleology is an aspect of consequentialism. I'm coming to explain for you to understand. Teleology is an aspect, it's more like an aspect of consequentialism. When we say teleology, what teleology, you see, consequentialists look at the results. Consequentialists will only check whatever action you took. Did you get a positive result? If you had a positive result, consequentialists will support you. But teleology don't look at just the results. Teleology will look at the goals and values of the hospital. Okay, what is the goal of the hospital? Okay, the goal of the hospital is to ensure all patients recover and they are discharged home. The teleologists, when they come, they are coming to check, okay, the action that you took, the results that you got, is it going to help the hospital to achieve their goals and objectives? So even if you went to steal a patient's medication, the patient to go and administer to another patient, and the patient recovered, at the end of the day, when a teleologist comes, the teleologist is going to check, okay, patient recovered, what is the goals of the hospital? The goals of the hospital is to promote recovery. Teleology will declare you to be right. But you see, teleology goes beyond consequentialist. Consequentialist is looking at the immediate result. Teleology is looking at the final goal. It's like the broader goal. the results that you got, is it contributing to the broader goal of the institution? Once it is contributing to the broader goal, teleology will not also listen to the action you took. Teleology will declare you to be right. That is teleology. Is that okay? So look, example, providing treatment aimed at restoring independence in a disabled patient. Providing treatment aimed at restoring independence. So you see, there is a goal over there. There is an emphasis on goal. You see, restoring independence in disabled patients. Okay. So a teleologist is going to judge morality. They are going to define morality, whether or not the results you got is going to contribute to goals, the major goals of the institution. That is a teleology. So teleology, in a way, is like an advanced form of consequentialism. Consequentialism will look at the results. Okay, you did wrong things. Okay, but at the end of the day, you had a positive results. No, in fact, consequentialists don't only look at it from the fact that patients will only do a wrong thing. In fact, they don't even check the actions. They only measure morality by the results. So don't go and say that and say you're saying that with consequentialism, when you do good, when you even do the wrong thing and you achieve. No, it's not only about, the emphasis is not even on what you did though. The emphasis is on, so whether you did good, you did bad, when they come, they are coming to check your results. So even if you did something good or you did something bad, the result is what we are going to use to judge you. We are not going to judge you based on the action you took, whether it is good or bad. A consequentialists don't believe in the action. Their focus is on the results. Okay, show us your results, then we will declare you good or bad. So if you show them a good result, they tell you, okay, you are moral. If you show them a bad result, they tell you that, okay, you are wrong. That is consequentialist. Is that okay? Teleology. Okay, what you did, does it contribute to the hospital goals? If it contributes to the hospital goals, it's okay, you are right. We don't care what you did. Teleology also no look at what you did. Whatever you did, okay, did they help in the hospital goals? That's all. Once it helped, that is it. If it didn't contribute to the hospital goal, you are wrong. Even if you observe ethical standards. That is teleology. Do you think teleology is a good thing? Teleology. Let's say you are owner of a hospital facility. Do you think teleology is something you should stand by or you should believe in? Do you think it's a good theory that you have to believe in? Yes. Let me have your opinions. Yes, let me have your opinions. Do you think teleology is something good you have to believe in? Yes. Any of you? Is this something good you have to believe in? Let me hear from you. Yes. Oh, can you hear me?
Yes.
Okay.
Yes, sir.
That is fine. So let's say you're a manager of a hospital. Let's say a nurse has done something wrong. Let's say, let me give you a practical example. A nurse, let's say, went to take another patient antibiotics, administered it to another patient. The patient recovered. At the end of the day, maybe your hospital goal, one of them is to ensure that patients recover safely and are discharged home. Fine. Now, the result is that what the nurse have done, it has contributed to your objective. Is it a good thing? What the nurse did, is it a good action? Yes. Even though the result is that the patient has recovered and the patient recovering contributes to your goal, but is it a good thing?
No, sir.
It's not. But you people said yes. That is teleology. So that is teleology will not also look at what you did, though, whether it is good or bad. Teleology would come and check, okay, what you did, does it contribute to the major goal of the institution? That's teleology. So teleology too is not something good. It's not so good. Okay. So with teleology, they will come and check, okay, they will judge your morality and they will define your morality to be very good or bad, depending on whether what you did, the results contributed to the main goal or the main objective of the institution. That is a teleology. It's also not completely good to practice teleology. Now let's look at the fourth one, utilitarianism. Utilitarianism is also a subtype of consequentialist. Okay. But then the difference between utilitarianism is that the action that was taken, does it give us an outcome that benefits majority of people, or does it give us an outcome that is logical, or an outcome that saves a reasonable life, or an outcome that reasonably safe? That is utilitarianism. So a practical example is that, okay, so for a utilitarianist, when they come, they are also not going to check what you did, whether it is good or bad. They will check, okay, the action that you took, did it save reasonably, or did it save a greater number of people? Please listen to the two conditions. A utilitarianist will check the action that you took. Did it save a greater number of people, or did it save someone's life reasonably? That is what we call utilitarianism. So, for example, maybe you take a decision as a nurse, then at the end of the day, you save a greater number of people. Let's say maybe a disaster happened on the ward, and let's say on the ward you are about 20. You took a decision. Maybe it could be the decision was a bad decision, but at the end of the day, you were able to save about 15 of the people. A utilitarianist will come and judge you right. They will check whether the action that you took, did it save a greater number of people? Okay. The emphasis over here is what? A greater number of people, or a greater good for the greater number of people. Okay. Now, the last one is institutionalism. Okay. Look at the example of the utilitarianism. Prioritizing emergency resources to save more lives. Prioritizing emergency resources to save more lives. You get it? So you prioritize, in an emergency, you prioritize. You get it? So you care. That's why if you go to an emergency where they have the yellow ward, they have the red, they have the green, you are prioritizing, so that at the end of the day, you'll be able to care for those whose conditions are very urgent. You offer care, so at the end of the day, you're able to save lives of a greater number of people. So it's utilitarianism. So utilitarianism, so you realize that for a utilitarianist, when we come to the ward, all patients demands healthcare. They have the right. But utilitarianists will prioritize. Utilitarianists will not come and say that, oh, you've left these patients, you are caring for these patients, so you are wrong. They will check whether the decision you've taken is going to benefit and save greater number of people reasonably. Then they will use that to judge. That is utilitarianism. Then we have institutionalism. Do you get it? Institutionalism. Now, institutionalism is when you are guided by your intuitions or concerns. You realize that, you see, there are times that nurses, you use your intuitions. Have you observed that? There are times that you do certain things that it's not necessarily like a standard. You use your intuition. So it's a moral decision guided by intuitions or concerns, not rules or outcomes. Okay, so institutionalism believe in intuition. So sometimes you take certain decisions using your intuitions. It happens. So that one is more like a moral decision that is guided by your conscience. Okay, they are not more like rules. They are not more like outcomes, but you use your conscience to take a certain decision. Okay, so look at an example. A nurse instinctively comforting a crying child without needing a policy to direct it. So, for example, you are comforting a patient. There is nothing like any rule. There is nothing like any ethical principle that charges you to do that. What you are doing, you are using your intuition. So, for example, a nurse singing for a baby. There are no ethical principles. There are no it's institutionalism. You are using your intuitions. That is what we call institutionalism. You are using your intuitions and your concerns to do something just to what? Achieve something positive. Do you get it? And that is what we call institutionalism. Let's look at a question on ethical theories. Let's look at one question. Then you tell me the answer. A hospital has only one ventilator left. The healthcare team must decide whether to give it to an elderly patient with low chances of survival or a young trauma patient with high chances of recovery. The team decides to allocate the ventilator to the young patient because it will save more years of life. This decision best reflects which ethical theory? A, deontology, B, utilitarianism, C, institutionalism, and D, teleology. What is the best answer? Yes, what is the best answer? A hospital has only one ventilator left. The healthcare team must decide whether to give it to an elderly patient with low chances of survival or a young trauma patient with high chances of recovery. The team decides to allocate the ventilator to the young patient. It was the young patient because it will save more years of life. This decision best reflects which ethical theory? Yes, which one will you choose as your answer? Which one will you choose as your answer? Let's be fast about it. Yes, which one will you choose as your answer? Hello, are you there?
A.
A, deontology. Okay, any other person? Any other person? Yeah, this is how they trick you people though. They will always trick you. Simple things, then they will trick you. Any other person, please? Yes. Yes, please. I can't hear you, please. Institutionalism is very simple. Though. When you are using your intuition to do things, institutionalism is like things that you do. We don't have any protocol. There are no protocol. It's like they are not within protocol. They are not within any ethics. They are not within any standard. For example, there is no protocol that tells you that when you are nursing a child, sing for the child or, try to comfort the child or try to play with the child. There is no protocol or ethical standard like that. So when you are using your own conscience or your own more like intuition to do something, that is what we call institutionalism. Do you get it? And forget about the word institution that is inside though. Institutionalism in ethical theory means using your intuitions. You are letting your intuitions guide you. Do you get it? That is what we call institutionalism. Do you get? So, for example, let's say you are trying to sing for a patient, or you are trying to even play music to a patient on your phone. There is no protocol like that. There is no ethical standard that charges you to do that. But you are using your intuition to do that. It falls under institutionalism. Do you get it? So institutionalism comes in when like there are no standards. The institution have not specified a standard. Then the nurse use the mind to do it. Then we achieve something positive. Do you get it? That is what we call institutionalism. Okay, so let me give you a practical example. They can give you a scenario like, okay, in a facility, where there are no protocols to dress wound, and a nurse dresses wound in a certain way to achieve a positive result. It's institutionalism. Why? Because there are no protocols, there are no standards guiding that activity. But the nurse decided to do something using their own conscience to achieve a result. So that is institutionalism. So with institutionalism, there are no rules, there are no standard, no protocols guiding that particular action. But you choose to do something, do you get it? That help or to achieve something positive. That is institutionalism. Is that okay? That's institutionalism. Okay. So which ethical principle? The question. So someone have answered. Someone says it's deontology. The rest of you, which one will you choose as your answer? A hospital is having one ventilator left. The healthcare team must decide whether to give it to an elderly patient who have low chances of surviving. And then we have a young man who have suffered a trauma, who have high chances of recovery. Then the team decided that, okay, let's give it to the young man because that young man can recover, so that we save the young man more years of life. Which this decision best reflects which of the ethical theories? Is it deontology? Is it utilitarianism? Is it institutionalism or teleology?
It's the deontology.
All right. So I want to let you understand that this question, the answer is not deontology. That shows you didn't pay attention to the explanations. This question, the answer is utilitarianism. Look at utilitarianism. Utilitarianism provides the greatest good for the greatest number. Did you pay attention to that? And I explained to you that when we say utilitarianism, it's like you are taking a decision, okay, to at the end of the day, to provide the greatest good, to achieve something positive for a greater number of people, or to achieve something positive reasonably. If you remember, I even use the word reasonably or logically. When you do something, forget about the statements being positive. Oh, utilitarianism, it can be good or bad. Do you get it? It can be good or bad, but utilitarianists also look at the results. Oh, look at it. Look at it. Utilitarianist, what will let you know that the thing is good or bad? Utilitarianist doesn't measure. But then listen, deontology check the action, not results. Deontology, they check action, not results. If you really paid attention to the explanation, you know the answer can be deontology. Because deontology don't focus on consequences. Look, regardless of consequences. Look, regardless, deontology don't care about the outcome. They are interested in the action. That is why I said you didn't pay attention to explanation. Look, deontology, decision. So whether for deontologists, whether you are right or wrong, it depends on the decision you took. But look at this question. A hospital has a ventilator, only one ventilator. Look at it too. The healthcare team must decide whether to give it to an elderly patient with low chances of survival or a young trauma patient with high chances of recovery. Now look at it too. The team decides to allocate the ventilator to the young patient because it will save more years of life. So you see, results has come inside. You see now, results has come inside. So it can never be deontology. If it is deontology, you won't talk about results. Once it is deontology, we will only talk about the action that they took, put the results out somewhere. We don't care whether it will save life or it won't save. And deontology, another emphasis is that deontology, the scenario will emphasize on something moral or ethical. Listen to it carefully. If you want to know a scenario is deontology, they are going to emphasize on something moral or something ethical. Did you see emphasis on something ethical or standard in there? No. Look at the definition for deontology. Duty-based ethics. Look at the scenario. Do you see any emphasis on something ethical or something standard or a protocol? No. We are not saying what they did is wrong, but what they did doesn't fit under deontology. Because in deontology, we are expecting an emphasis on something morally ethical, especially ethical principles in nursing. This question, the answer is utilitarianism. Utilitarianism would take a decision that would achieve something good logically, that will give us an outcome that will affect a greater number of people. Okay, have you forgotten we even look at the example for utilitarianism? Look at the example. You didn't pay attention to the example. Prioritizing emergency resources to save more lives. Look at the example, it's even there. Prioritizing emergency resources to save more lives. Do you get it? That is utilitarian. So utilitarianism, we will not judge you. Okay, the scenario you are going to check, you will not judge you based on the results. Utilitarianism is not also going to check the results. No, sorry, it's not going to check the action you took. We are going to check whether the action you took, we have a positive result. So see, what is the results? The team decides to allocate the ventilator to the young patients because it will save more years of life. Do you realize that what the team did is wrong? Do you realize that it's wrong? Because see, what the team did, why is it wrong? As a nurse, are you not supposed to treat all patients equally? So there is a moral or ethical gap over there. What the team did is wrong ethically, so it can be deontology. Do you get it? It can be deontology because deontology wants you to meet ethics. Deontology will ensure that you met ethics. So if you want to ask to argue that it was deontology, the decision should be that, okay, they decide not to administer the ventilator to any patient for all of them to die. That would be deontology, because deontology says, or they would decide that, okay, let's give put the ventilator on patient A for 5 minutes, then we put the ventilator for patient B for 5 minutes, then we change over like that. That is deontology. Because deontology believes in ethics. They will not check results. But you see, utilitarianists check the results. Okay, we will be able to save one life. Okay, then let's save that one life. Logically, that is utilitarianism. It's very simple. You don't have to, struggle with ethical theories. They are very simple. Is that so? The best answer is utilitarianism. Okay, good. Now let's look at legal issues in nursing. Okay, legal issues in nursing. So in the general paper, they ask questions on legal issues. With legal issues, you have to understand when we say a law is like a system of binding principles that is established by a state to regulate the conduct and protect the rights of people. In nursing, we have, you know that in nursing, you are bound by law. That is why as a nurse, you can't go and steal. If you're a nurse and you go and steal on the ward and you are caught, you'll be charged to face the state because it's a crime. The fact that you're a nurse doesn't give you the liberty to commit a crime within the health space or the health fraternity. Do you get it? And that is the reason why, as a nurse, if you commit a crime, if you are not careful, apart from the fact that you face the state, your license may even be taken away from you as a nurse. Is that okay? And then we have rules and regulations. When we say a rule is like a specific. So you see, we have laws in Ghana. Laws are instituted by the state, but regulations can be instituted by an institution. Please know the difference, because they will quiz you on it. They will ask you questions on it. Laws are instituted by the state. Laws, they are instituted by the state. But when it comes to institutional level, so for example, when we go to CAF University, you people have rules and regulations. You don't have laws. We can only say you have law when it is actually written, instituted by the state. So at the institutional level, we use rules and regulations. So when we go to maybe Kolebu nursing training, Pantine, CAF, maybe UHAS, Central University, Pentecost, they use rules and regulations. But when it comes to laws, laws are more like binding principles that are established by states to guide the conduct and protect the rights of people. That is laws. You get it? Then we have rules and regulations. Okay, rules and regulations are more like requirements. Sometimes there are requirements under laws that guides our day-to-day professional conduct. So NMC have rules and regulations. If any institution that you go, you realize they have rules and regulations. So, for example, if you go to, let's say, Rich Hospital, they have times they report to hospital. Their shift system may be different from when you come to Kolebu. There are some wards they may do 12 hours. Some wards they do 8 hours. So they have rules and regulations. They can vary depending on the institution. Is that okay? Another example is that rules and regulations, they provide details on how laws are applied. Rules and regulations also try to add more details to laws. So, for example, you can have in Ghana, stealing is a crime. But if you go to any facility, they can provide more details on stealing as a nurse or stealing as a patient or stealing as a patient relative. They can provide more details just to emphasize on existing laws. So sometimes rules and regulations may even provide more emphasis or details on already existing laws. Is that okay? Great. For example, NMC, the component tags that you people they've been using to assess you. It's for you to know rules and regulations. So, for example, when you are going to give medications, you know all the process you are supposed to walk through before you give the medication to minimize errors. All that are rules and regulations. They are regulations guiding how things are expected to be done. And sometimes when you fault any of those regulations, we can say you've committed and you've breached a regulation. And sometimes you may be punished. In some cases, your license may even be taken from you. And then we have standards. Standards are like authoritative statements that describe the level of quality and competence that is expected of you. For example, if you come to if you go to some of the schools, they have academic standards. There are some schools, if you don't sustain a certain GPA, they may not promote you. There are some schools at level 100. If you don't achieve, let's say, a GPA of, let's say, 2 points, let's say 0, they won't promote you to the next level. There are some schools, they have a standard, academic standards that if you don't meet a certain GPA requirement, they won't register you for licensing exams. That one is a standard. Standard is like a statement describing the level of quality, defining the level of quality that is expected within a certain institution. Okay, that is a standard. So, for example, a standard is more like a benchmark. It's like a target. That is a standard. A standard. So we can have rules and regulations in a hospital, but the hospital can have a standard. They can have a target that they want to achieve in terms of professional conduct, in terms of behavior and all that. Okay, so standard is different from regulation. So a practical example, maintaining patient confidentiality, infection prevention standards. So you see, that one is not a regulation. Regulation is more like something that looks similar, like a law. It's like a law in an institution. That is a regulation. A regulation is like a law in an institution. But a standard is like a benchmark for us to conclude that, okay, this person is ethical. This person is right. A standard is like a benchmark. Not necessarily a law. You will not go to any hospital and go and see they have a law about confidentiality, but it's a standard. Do you get? A standard is like a benchmark. What is expected of? It's like a boundary. That's a standard. Is that okay? So unless I don't think there is any law on how to dress wound in hospitals or any regulation, but we have standards that guides how wound dressing is supposed to be done. Standards are more like protocols. Do you get it? They are more like, so if you come to the hospital and you come and do something different, then we can say that no, you are doing things outside of standard. And let me show you something. And that is how we have malpractice. So if you do things that does not fall within the standard, then we say that you've committed a malpractice. And that is how you'll be able to know the difference between malpractice and negligence. Okay, negligence is when you fail to perform your professional duty, what is expected from you. But malpractice is when you fail to observe a standard. Okay, so for example, a nurse failed to come to work on time. That is a malpractice because you fail to observe a standard. But when a nurse, you expected to raise bedside ray, you didn't raise it. That is negligence. You didn't raise it. Patient fell. That is negligence. Okay. Another example is a nurse. You are expected to give medication to a patient. You didn't give. Patient died. It's negligence. Do you get it? But malpractice is when you fail to observe a standard. A nurse, you are supposed to dress appropriately. You didn't dress appropriately. That is a malpractice. It's not negligence. Okay, so negligence is when you fail to meet standard. There are two different things. So I will explain that later on. Don't worry. Okay, don't worry. I will explain all those things later on. Okay, so when we say legal issues, usually legal issues arises when the nurse practice is governed or challenged by laws. So when we say legal issues usually arise when a nurse's practice is governed or challenged by laws and regulations. And usually they are enforceable by courts and legal bodies. So a practical example is a nurse who administers the wrong drug dosage, leading to a harmful, may face negligent charges. You see the example over here. So malpractice is like, okay, a nurse, you're expected to dress in this way. You didn't dress that way. That is a malpractice because we have a standard of how, it's like we have a benchmark of how you are supposed to dress. Okay, a nurse, you are supposed to report at this time. You didn't report that time. That is, it's malpractice. That one is not negligence. That one, you didn't fail to administer your professional duty. You failed to observe a standard. You failed to observe a benchmark. That is a malpractice. But a nurse failing to observe professional duty, that is negligence. I'll explain later on over here. I have a slide on that because they always ask questions on those two things. And I think I made, yes. So here is it. Malpractice and negligence, they often overlap. I will talk about it when we get over there. Okay, so we have ethical issues. Ethical issues involve moral principles guiding the right and wrong behavior in nursing practice. They are usually enforced by laws, but by professional codes of ethics. Okay, those are ethical issues. Ethical issues are things that involve moral principles, like things that help to institute, decisions that are right, actions that are right and wrong. They are the ethical issues. And I think I mentioned that when we started. And legal issues are issues that arises when a nurse practice is governed or challenged by laws. So when a nurse, you do something and it is challenged by a law, it is governed by a law. It means, in fact, the word itself, there are so many ethical issues. That is why a nurse, when you are doing things, you have to be very careful because we are always, our environment, we are exposed to ethical issues. So you always have to be very careful. And sometimes you'll be shocked that patient is watching you. Some patients may even be videoing you unaware. You may not know they may be videoing you. So you always have to be careful. There are some patients, they can set cameras somewhere. They'll be videoing your actions. You may not know evidence that people will bring when something happens on the ward. So you always have to be very careful as a nurse. Now, let's look at some types of laws that are relevant in nursing. And the emphasis is going to be laws that they've asked questions on before in the licensing exams. Now, understand that we have two main types of law. We have criminal law and then we have civil law. They won't ask you questions outside of these two things. We have criminal laws and then we have civil laws. When we say criminal laws usually deals with crimes against the state. So someone have committed a crime against the state. Do you get it? Usually criminal laws, the individuals may face penalties that includes either imprisonment or fines. So someone has committed a crime against a state. If you want to know examples of criminal laws, like murder, like manslaughter, like kidnapping, assault, a battery, all these are crimes in nursing. Sorry, let me put it that way. Crimes in nursing. So as a nurse, if you commit murder, it's a crime. Oh. It's a crime. You've committed a crime and you face criminal law. You commit a murder. You help, even if you help someone to commit a murder, you've committed murder. Okay, then we have murder. When we say murder is when you intentionally decide to kill a patient as a nurse. So you decide, it's like you are aware. You know that this medication, when I give it to patient A, patient will die. You go ahead to give it and patient die. That is murder. But when we say manslaughter, manslaughter is like you are going to give a medication. You don't know that when you give that medication, patients can die. Or you don't know that the dose that you are going to give, probably the doctor wrote it. You don't know that dose can kill patients. You gave it and patient died. That one, patient died, but it wasn't your intention. That one is manslaughter. They are two different things. So murder is like you are intentionally, deliberately taking an action and it leads to the death of someone. That is murder. But manslaughter is when you unintentionally kill a patient. Okay, so maybe through a medication error, you cause the death of a patient. That one is manslaughter. Then we have kidnapping. This kidnapping thing, previously the midwives were being charged with these things a lot. Kidnapping. You get it? Moving or detaining a patient against their will is considered kidnapping in nursing. You get it? Kidnapping. Okay, good. And even if you transfer patients out of ward without permission, without the patient consent, it's kidnapping. No. You transfer patient from the ward. You didn't tell you're in charge. The patient is not aware. Relatives are not aware. That one in nursing is kidnapping. Please, so be very mindful with the scenarios they will give you. Is that okay? Then we have assault. Assault is when you threaten harm without physical contact. So, for example, you tell a patient, okay, you are insulting me. Okay, say you've not been discharged. We will see. It's an assault. You see, there is no physical contact. You didn't touch the patient. Or you tell your colleague, like, okay, say we are all on this ward. Me and you, we will see on this ward. It's an assault. You didn't touch the person. You've not touched the person. That person can sue you. It's a crime. Do you get it? That is an assault. Okay, so an assault is when you threaten to harm someone. And assault is not backed by any physical contact or an action. Okay, then we have a battery. Yes, ask your question, Valeria.
Yes, the kidnapping.
Yeah.
What if patient was not able to pay his or her hospital bill, so you detain the patient? Is that also kidnapping?
Good. So look at the statement. Against their will. Do you get it? So you are detaining a patient against their will. So for example, patient has been discharged. They don't owe the hospital. Relatives don't owe the hospital. You decide to detain them. That is kidnapping. Do you get it? That is kidnapping. It's a crime. But if patient has paid the bill, they don't owe the institution, they've not committed any crime, do you get it? And you detain them, that is kidnapping. You've kidnapped the patient. You get, and that is a crime. That's the meaning. That's the explanation we are trying to give. So as a nurse, you shouldn't support such a situation. Then we have assault. So I explained assault. Now the next thing is a battery. Battery is when you add action to an assault. So it's like you tell your own colleague, okay, sir, we are all working on this word. We will see. Then you actually go ahead to do something to harm the person physically. That is a battery. Do you get it? So you tell a patient that one day I will give you injection. It will pain you the rest of your life. Then you go ahead to actually inject patient. You push the needle to touch the bone. That is a battery. So an assault is when you said it, but then you didn't attach any physical contact or an action. But a battery is when you actually make the proclamation and you back it with a physical contact or an action without the patient's consent. That is what we call a battery. All these crimes that I mentioned, murder, manslaughter, kidnapping, assault, and battery, they all fall under criminal law. You should know where they fall. Then we have civil law. Civil law usually governs disputes between individuals and then outcomes. Usually the crimes involve just compensation. As example, in nursing, negligence is a civil, falls under civil. And then malpractice, defamation. Okay, so negligence, for example, failing to do what you are supposed to do. For example, you are supposed to serve your medications. You didn't serve medication. That is negligence. At 10 p.m., you are supposed to serve a patient a painkiller. You didn't serve them, and that is negligence. Negligence is not more like, it's not a crime, but then it falls under civil law. It's a crime, but then it falls under civil law. Do you get it? It's not something that is so usually the punishment for crimes that falls under civil law. It usually requires compensation. They may charge you to compensate or pay a fine. Is that okay? So negligence, malpractice. So for example, we can say that come to work at, let's say, 8. You came at 10. What you do is malpractice. That one is not negligence. So that one is malpractice. You fail to observe a standard. That one, we are not going to say we are going to put you in prison. We can let you pay a fine, or we may take your license. Do you get it? It may come with some minimal punishment. That's a civil law. Is that okay? Another example of a civil law, crimes that falls under civil law, is controlled drug violation. You are selling drugs. You are selling tramadol to patients. Controlled drug violations. Improper administration of narcotics. Patient is not on tramadol. Only you, because you sell tramadol, when you come, you can give one patient 3 tramadol to take at once. Controlled drug violations. Patient is not on Petidin. Because you sell it, you can administer Petidin, almost 200 milligrams to one patient. Controlled drug violations. It falls under civil law. Misdemeanors. When we say misdemeanors are more like minor offenses. For example, breaching confidentiality is also an offense. For example, patient information, you go and tell relative without patient consent. Misdemeanor. That's what we call misdemeanor. So misdemeanor is more like minor offenses. Okay, you are writing documentation. The documentation, you didn't do something, you write that you did it. For example, something happened, maybe you were sleeping, you woke up, patient is dead. Then you go and write that you did resuscitation and things. Meanwhile, you didn't do, you can be charged with misdemeanor. Okay, so they are like, misdemeanors are more like minor offenses. For example, you know that when you are dressing patients, you are supposed to use surgical glove. Then you use disposable glove, or you use your bare hands. Or you even tell patient relative to do the dressing whilst you are standing there watching. That is a misdemeanor. It's like a minor offense. Do you get it? Minor offense. It's like you are breaching confidentiality. You are breaching standards. Those ones comes under misdemeanors. Okay. Another type of form of civil law in nursing is this, torts. In fact, this one, you would always see a question on it in licensing exam. Torts. Okay, torts. The torts is like a civil wrong. You know, misdemeanor is a civil wrong. Controlled drug is a civil wrong. So these are, negligence is a civil wrong. Malpractice is also a civil wrong. Defamation is also a civil wrong. But battery is a criminal wrong. Assault is a criminal wrong. Kidnapping is a criminal wrong. Manslaughter is a criminal wrong. And then murder is also a criminal wrong. Okay, then we have torts. Okay, torts. In nursing, tort is classified under civil wrongs. Now, when we say torts, we can have intentional torts and we can have unintentional torts. Do you get it? So you see, If a nurse, you commit an assault or a battery, we classify it under intentional thoughts. A nurse, when you commit an assault or a battery, we classify it under intentional thoughts. Both assault and battery. Okay, so intentional thought is like you are deciding. It's like something that you preconceived. When we say intentional thoughts, it's something that you preconceived. So like an assault or a battery, you see, you have to preconceive. You should think about it. Even if I tell you that, okay, me and you say we are on this world, we will see. Even if I assault, I didn't do anything. I didn't back it with an action. I preconceived before doing so. It's intentional. You can't say that you are not aware and you threatened somebody. You can't say you are not aware. So it's intense. So that is why both assault and battery is classified under intentional thoughts. And there is a question on it too. If those of you who have solved 2016, check. There is a question on thoughts, intentional and unintentional thoughts. Okay. Defamation is also an intentional thought. Defamation is when you decide to say something false about someone. When you say it verbally, when you use your mouth to say it verbal, oral, that one is what we call, the verbal one is slander. So when we say slander, it's like a verbal defamation. So you go on afternoon duty, then maybe you go and say something bad about another colleague orally, or even through phone call, you say something bad about someone, either your colleague or another patient. That is a slander. It's defamation, but that one is slander. Okay, slander is a defamation that is oral. Okay, verbal. And when you write it down, so maybe through text message, then you text something bad to tarnish the image of a patient or a relative or your colleague in a form of a writing. That one is the libel. So libel is also a form of defamation, but libel and then slander, they all fall under intentional thoughts because you preconceive, you thought about it. Do you get it? Then we have what we call false imprisonment. Okay, false imprisonment. So this is where the lady that asked the question, this is where your answer is to see. False imprisonment. Restraining a patient without justification is false imprisonment. That is what we call false imprisonment. Doesn't mean we imprison someone wrongly. That is what the public think. Oh, you restrain a patient without justification. It's false imprisonment. The crime you've committed is false imprisonment. You are restraining a patient without a nurse. You went to the ward. Patient has not done anything. You go and restrain the patient. No justification. Patient is not aggressive. Patient is not misbehaving on the ward. Patient is not inflicting or posing danger to other patients. You restrain that patient. That is false imprisonment. You can be charged with civil as a civil wrong. Is that okay? Then we have the unintentional thoughts. Unintentional thoughts, we have two examples. We have negligence and then we have malpractice. They all fall under unintentional thoughts. Negligence and then malpractice. When we say negligence, negligence is failing to act as a competent nurse would. So for example, leaving bed rails down, leading to patient fall. Okay, your negligence can cause someone's harm or death. Negligence is not always going to result in death. It can result in harm, it can result in death, or even an injury. Okay, so failing to act as a competent nurse, that is negligence. But when we say malpractice, look at the difference. So this is what I want you to learn. When we say malpractice, it's a professional misconduct. You fail to meet standards. You get, so look at the difference. So a nurse, you fail to meet standards. So for example, you are supposed to dress a certain way. You know, nurse, you are supposed to serve medication. You go on afternoon shift. You don't serve any patient's medication at all. That is malpractice. But look, a nurse, you are supposed to serve medication. The medication is 1 gram. You chose to give 500 milligram. Patient died, or the medicine didn't work. That is negligence. You see, there are two different things. So a nurse, afternoon nurse, you're supposed to give medication at 6. You didn't give it. You failed professional conduct. That is a malpractice. But negligence is okay. The medicine, you are supposed to give 1 gram, you gave 500 milligrams. That is negligence. You fail to be competent. You are not competent, so that is negligence. I don't know if you've gotten the two. Let me give you another practical example for midwives. So, for example, a midwife, during delivery, there are certain preparations or requirements that you are supposed to have. You didn't do it. You failed professional conduct. Let's say there are some items you were supposed to bring, you didn't bring them. But when it comes to negligence is like, probably maybe during the delivery, you are supposed to give a certain medication. Or let's say you are doing episiotomy, you are supposed to cut in a certain way. You cut it wrongly, and it causes further harm to patients, which is not expected. That is negligence. Negligence means you are not competent as a professional. And malpractice is when something that is expected of you professionally, you didn't do it at all. That is a malpractice. So negligence, the action was done, but then you didn't do it competently. That one can be negligence. Negligence can also be you fail to do it completely. So, for example, if someone fails to do something completely, we classify it more under negligence and not malpractice. Okay, let's look at an example over here. Let's look at this example. Okay, this question, for example, a nurse administers wrong medication to a patient, causing serious harm. You see, this one is a malpractice, so look at the difference. But if we say that the nurse administered a wrong dose, you see, this one, the nurse completely administered a wrong medication. So you see, this is not even talking about competence. So what you did professionally is wrong. You get here, the action that was taken professionally, in fact, was wrong completely. So it's a malpractice. But then let's say the nurse supposed to give 1 gram, you gave 500 ml. So that one, there is a breach in your competence. That one is a negligence. Or let's say the nurse decided not to give the medicine at all. That one is also negligence. So negligence is when your action shows you are not competent. But then if your action shows that the thing, it wasn't done at all, that one too is also negligence. You get? But if what you did, you'd fail to meet professional expectation, then we will say it's a malpractice. You get? So negligence is failure to act reasonably. Look at it all. To act as reasonably careful person would. Do you get it? In fact, negligence can apply to anyone at all professions, not only nurses. But look at malpractice. Malpractice is a professional negligence. And malpractice applies only to professionals like nurses, doctors, when they fail to meet professional standards. That is a malpractice. Do you get it? Now, so look, in an MCQ about nursing practice, if both malpractice and negligence are options, the better answer is usually malpractice because it is specific to nursing. Keep it in your mind. Is that okay? Keep it in your mind. Now, I know all of you are very familiar with this paper. Anytime you see this paper, you know we are coming to talk about documentation. Is that okay? In nursing, anytime you see this paper, everybody knows that we are coming to talk about what? Documentation. In fact, documentation is also one of the areas they will assess you on in the general paper. What is documentation? Documentation means you are recording the patient's care, the care that you render to a patient. You are recording it. Yes, someone is asking a question.
Sir, please, what of common law?
Okay, common laws. Common laws. Institutions can have common laws. Common laws, even authorities like, for example, sub-administrative bodies, like, for example, NHIS, they can have laws. Is that okay? There are laws that are not really statutory laws. So, for example, an institution like Nursing and Midwifery Council, they can have common law. So, like, they are sub-administrative authorities, laws that they come up with. Those ones, we call them common laws. Now, we have several classifications of laws, but because we are not doing law here, I just wanted to skew my lecture just to concentrate on the areas that they ask you questions on. We have statutory laws. Statutory laws are the ones that are passed in Parliament and then they are accepted. Sometimes statutory laws can be laws that maybe through judicial rulings, maybe a certain judgment was made during a court case. Then they come up with certain decisions. Then they can pass it through Parliament. It will be approved, signed by a president. It becomes a statutory law. Common laws, they are like NHIS. They have their laws. You know, National Health Insurance Scheme, they can have their laws. If you go to any ministry, like Ministry of Environment, Ministry of Sanitation, Ministry of Lands and Forestry, they can have their own sub-laws. Those laws are common laws. If you go to certain facilities or institutions, they can come up with their own laws. Do you get it? Those ones are usually common laws. And sometimes common laws are not written. Okay, there are times that the common laws, they are not written. Is that they are the common laws. Okay, so for example, Kolebu Teaching Hospital or Ministry of Health, they have their laws. Do you get it? Usually those laws, some of them are not written. In fact, some of these laws usually come to be with time based on maybe professional conduct or maybe based on cultural practices within that organization. Okay, good. So documentation. I mentioned that this paper, all of you know this paper. When you see this paper, you can see the way this nurse is very busy here trying to document something. Why do we do documentation? You document as a nurse, you document the care you give. So if you don't document. Whatever you do, that is what you document. That's the principle. Okay, so you document observations, things that you see. You document decisions that you take. Okay. And what is the relevance? Why do we do documentation? Why is it important? It's a legal evidence. Documentation is until something happens to you as a nurse, you don't understand the importance of documentation. Until something happens, an incident happens, you will never value documentation. An incident happening, lawyers are chasing you up and down. You will never appreciate documentation as a nurse. So as a nurse, every single thing that you do, make sure you take every step to ensure it has been documented. Do you get it? And then it's a communication tool. When you document, when night nurses come, they will see what was done during the day. When afternoon nurses come, they will see what was done during the morning shift. It's like a communication tool. They don't need to call you. So if you're a nurse and you document properly, you will be in your house at peace. No, people will not be calling you. Did you give this? Imagine you went the whole shift. You didn't document the medications you gave. You didn't document the wound dressing. They will be calling you from morning to evening. The morning medication, did you give? Did you check the vital sign? What did you get? They will be calling you. If you like, one day go on a shift, be an in charge, don't document anything, and see the calls that you are going to receive at home. Everything, doctors will be calling you, nurses will be calling you, HR will be calling you, because everybody don't understand what happened on the shift. Yeah, but if you document, when they check, your documentation speak for you. It's like your documentation represents you. It speaks for you in your absence. That's the essence of documentation. Documentation also ensures continuity. So if you document that, you give paracetamol, we won't come and give. We will give the next shift. So it ensures continuity. Documentation can also aid in auditing. It can aid in research. Now look at the principles of documentation. I want you to pay attention to these 5 principles. These are the principles of documentation. Please listen. They will use these principles to ask you one question on documentation. A good documentation should be accurate. It should be complete. It should be timely. It should be very clear and legible, and it should be confidential. Now, if you document, let's say you document something about a patient, then you go and read it to another patient. It's not a good documentation in nursing. A good documentation should have these characteristics. It should be accurate, it should be complete, it should be timely, it should be clear or legible, and it should be confidential. So we have some nurses, and when they write, they are the only people who can read. You are not doing documentation in nursing. Documentation should be this: clear and legible, easy to read or understand. Yes, so if you are fond of that, you write and you are the only one who can read. It's not documentation in nursing. In nursing documentation, whatever you write, any other person should be able to read. If other people are not able to read, it's not a good documentation. And that is how you measure whether a documentation, if they give you a scenario, look at the scenario, whether it features these 5 principles: accuracy, completeness. There are some people, when they are documenting, they document the parts they feel they should write. You did something for patients, you go and document what you feel. Do you get it? You didn't write everything. A good documentation should be complete. Include all relevant details. Whatever happened, a good documentation should be complete, should be timely, indicate the time. Can you imagine you documenting without adding time? Do you get it? And another thing is that there was a question that they asked. They asked a question like, I don't know if any of you have met it somewhere. When you finish a procedure, when do you document? You document the next shift. You document immediately after the procedure. You document the next day. What will be your answer? A question like that, what will be your answer? After a procedure, do you document it the next day? You document immediately after the procedure. Yes, and they've asked a licensing, someone will wonder, hey, this one, but they've asked a licensing question on it. After a procedure, and they didn't even ask in general paper, in surgery. After a procedure, you document immediately after the procedure. Immediately after the procedure. That is why we are saying, look, timely. You chat immediately after the care. So you don't do documentation, then you wait and document the next shift. You do a procedure, then you are waiting to document the procedure the next shift or the next day before you go in. It's not a good documentation in nursing. Is that okay? Good. Now, the next area you should be prepared for is informed consent in nursing. Informed consent in nursing. When we say informed consent is a process where the patient receives clear, complete, and accurate information about what? About a procedure, treatment, or understands it, voluntarily agrees. Now, look, I want you to pay attention to this very slide. This very slide. See these characteristics of a good informed consent. You should be prepared for one question on this. They will give you one question on this in general paper. They will give you one question on this in medicine and one question on this in surgery. They will always ask you one question on this informed consent in medicine. You use these characteristics to answer. And they will ask one question on this same informed consent in general paper and the same thing in medicine. And you use this very points. So a good informed consent, you should, if they can ask you a question like, okay, how they can give you a scenario, then they will ask you whether it was a good informed consent. Now, a good informed consent should involve these characteristics. It should come with explanation of the procedure. It should come with you telling the patient the risks and complications. Now, a good informed consent, you should talk about the benefits. Okay, the benefits. The expected benefits. A good informed consent, the expected benefits. A good informed consent, you should give the patient the alternative. So, for example, if you are going to give informed consent to patients, you should be able to go and read and tell the patient that, okay, if you choose not to do this procedure, there is this alternative that can be done. Okay, if you choose not to do this surgery, I think we can put you can consider we putting you on this medication. If you are giving a good informed consent should feature you telling patient alternatives. And they've set a question on that before. If you look at it very well, this is the reason why sometimes those who know me will tell you I usually don't like to teach students with my slides. So when I come and I'm teaching you the information without slide, you may think I have slides that I'm always updating on. This very slide, this point, I've updated it about 5 times. So I will go and see a new past question. They've added a certain consent characteristics, then I'll come and add it to it. Okay, so a good informed consent, and you realize that most of us see informed consent to be very shallow. Some people even think informed consent is going to tell the patient what the procedure is. Until now, some of you didn't know informed consent. You should even let the patient know other alternatives. So if they give you a scenario and they are telling you things you should expect a nurse to do during informed consent, you see alternative. Maybe some of you may not choose that option. You may think it's not part. Alternatives. A good informed consent, if you are obtaining informed consent, you don't allow patient the opportunity to ask questions. It's not a good informed consent. A good informed consent there should be comprehension. Patients should understand the information given. You don't use technical language. So for a nurse, you are going to give informed consent. You are using medical terms, big medical jargons. It's not informed consent in nursing. There should be comprehension. You should observe comprehension, meaning you should use simple words, simple language, and they've used this to set questions. So a nurse was giving informed consent and was strictly using medical words, like they didn't break down the words. They were using medical terms like 8 hourly, TDS, those kind of things. That question, the answer was not. It was improper informed consent. Improper. You should use simple words for the patient to understand. Do you get it? And a good informed consent, they should voluntariness. There shouldn't be force. You don't force patients. You don't use coercion. You don't use pressure. And I think we solved a question that they use this one to set the question. You don't give patient pressure. It should be voluntary. Patients should voluntarily agree to consent. Okay, and I remember we solved a question like that. You saw it. And it's a licensing exams question. Is that okay? And a good informed consent, there should be capacity and competence. Patient has legal age, sound mind to decide. If you remember, there was a certain question, and the answer, most of you got it wrong. If you can't take informed consent from a baby. There was a question, and I don't know, but I think we will look at it again. They use this one to solve the question. Capacity and competence. It's not every patient who have the right to consent. That was what the question was about. It's not every patient who have the right to consent. The person should have the capacity and competence. You can't go and say a mad person to consent to a procedure, or a child, a newborn baby should consent to a procedure. The person should have the capacity and competence. Patient has the legal age and sound mind to decide. You can't go and say an unconscious stroke patient to consent to a procedure. The person who consents should have the legal age and sound mind to make the decision. And a good informed consent should follow up with a documentation. It should sign. And there was another question too on that. I don't know if you remember. So a good informed consent, it should be written. You can't say a patient should consent verbally. No. A consent form shouldn't be verbal. It should be written. Under no circumstance should you accept an oral consent as a consent. It should be written on a paper. It should be signed on a paper, written. Consent is not given orally. Keep it in your mind. Okay, and we will revisit that question again. A good consent should have a witnessed. It should be witnessed. So you obtain consent from a patient alone as a nurse. It's wrong. Get a witness. Let your colleague witness it. Let the relative witness. Let a third person witness the consent. Please be very careful about these characteristics. Take note of all these characteristics. Do you get it? And as a nurse, this is your role during informed consent. This is your role as a nurse. Your role is to facilitate understanding. Okay? Your role is also to witness that the patient has signed the signature. You are also supposed to be an advocate for the patient rights. You know, it's the right of the patient to understand the procedure. It's the patient's right to understand the procedure. It's the patient's right to refuse the treatment. So your role is to advocate, to stand in as an advocate. You are not the one supposed to give the explanations of the procedure and all that. You are just supposed to witness the signing. You are just supposed to make sure patients understand. Ask patient questions whether the procedure has been explained to them. They know the risks. They know the expected outcomes. They know the alternatives. They understand them in simple terms. That is your work. Do you get it? So that is it about informed consent. I think for now, we will end over here. So now, basically, we are done with the ethical principles, the ethical nursing, the things that you need for the legal and ethical issues in nursing. We are done. I think one other thing that I may teach you, or I haven't touched on so far, is what we call the ethical dilemmas. Oh, how did I skip it? How did I skip ethical dilemmas? Okay, before ethical dilemmas, we have something we call legally sensitive practical settings, or practice settings. When we say, they can ask you a question that, okay, which of the following areas in a hospital is considered as legally sensitive practice settings? When we say legally sensitive practice settings, they are like areas that if you are not careful, you are working there. If you are not careful, the least chance people can sue you. Those areas in the hospital is what we call legally sensitive practice settings. Now, look at those areas. Maternity wards are one of the areas. So, maternity wards. So, you're a nurse, a midwife, you work in the maternity ward. If you don't take care, someone can sue you, because you can have patients of someone who is like 45 years who have not given birth before and is pregnant for the first time. The least mistake, they will sue you. Probably the couples have been trying for so many years and they've not gotten a child. That one pregnancy, the way they value it than the whole hospital. If you joke, they will sue you. So the maternity ward is a legally sensitive practical setting. The maternity ward. Is that okay? So it's an area we don't play. It's not on this slide, but keep it in your mind. It's one of those areas. Okay, the emergency units. You know, emergency units, different kinds of people come there. You may not know that an accident can happen, and, you know, pedestrians can even bring a prominent person. So if you are working at the emergency, be very careful. Your ethical minds should be very sharp. Your ethical eyes should be very sharp. Yeah, they can even bring a president from another country to an emergency ward without your knowledge. Probably a president from another country came to Ghana, disguised. An accident happened. They will bring the person. Your ethical eyes should be sharp. If you are in those wars, make sure you are treating everybody equally. Be very just and ethical with your delivery, because those areas are sensitive areas. You may not know the person you are nursing. You may not know the background of the person you are nursing. Emergency units. Another area is the ICU, because during ICU, that is where end of life care, you know, those things happens, like ventilator and those things. And there are a lot of legal issues in those areas. If you are not careful, you'll be caught up with negligence and other things. Psychiatric facilities. Psychiatric facilities, you can be charged with this. Forced imprisonment if you are not careful. Do you get it? Confidentiality issues if you are not careful. Do you get it? Involuntary admissions if you are not careful. So psychiatric facilities, be very careful with legal issues when you are in those facilities. Geriatric facilities or long-term care. In fact, you may not appreciate some of these things in Ghana, because, you know, Ghana, we've not really gotten there when it comes to these legal matters. But now people are becoming aware of legal issues in our healthcare fraternity. So please be very careful when you are handling. The last thing we will talk about under the ethics, we have something we call the ethical dilemmas in nursing. Ethical dilemma. When we say ethical dilemma is like a situation where you are confused. It's like two ethical principles are conflicting. Let me give you an example. For example, you know that patient has the right to autonomy. As a nurse, you have to observe autonomy. Then let's say a patient is having a condition, okay, an unconscious. Let's say a patient has been brought in accident scene. The relatives are there. The patient cannot talk, or patient is unconscious. There is autonomy. You know, you don't have to disclose patient information when they've not given you the consent. Are you going to decide to tell the relative, or you are going to decide not to tell them? Because now you can't seek consent from patients. So there will be a dilemma. Okay, like two ethical principles will be conflicting. You will be in a confused state. A practical example is, okay, you know, sometimes a patient can be in a certain condition, or you can find out a certain diagnosis about a patient. Let's say an elderly patient. Probably the person is thinking, going through some depression. Then the relatives tell you that, okay, there's diagnosis, there's lab results. We don't want you to tell the patient. You see, when it happens that we are a nurse, you'll be contracting, or you'll be confused in making decisions between two ethical principles, because as a nurse, you have to let the patient have the right to know their condition. The relatives are also telling you, maybe because of the patient going to think about it and all that, don't tell. So you'll be conflicting between two principles. That is what we call ethical dilemma. Such situations where two ethical principles are conflicting is what we call ethical dilemma. Now, another example is, let's say, patients ask you of the prognosis of their condition, but then the family tells you that, okay, don't tell the patient. You see, you'll be contradicting, or you'll be conflicting between veracity and the non-malfeasance. Do you get? Because non-malfeasance says that do not do harm to patients. Relatives are saying, okay, tell the patient something else. Your ethical principle is also saying tell the patient the truth. So as a nurse, there will be a dilemma. Do you have to or you don't have to? Let me give you another example. The midwives. You are in the family planning unit. A woman came. You did your labs. The patient is having HIV, is HIV positive. Are you going to tell the husband or not? What are you going to do? You see, you'll be conflicting. Should I disclose it? Can you disclose it without the patient? If you don't disclose it to the patient, can infect the husband, or the man, the woman can infect the husband, or the man can, if the other way around, the man can infect the wife. So you are going to conflict between two ethical principles. Because you see, as a nurse, you are not supposed to disclose patient confidentiality. You are going to conflict between confidentiality or autonomy, and also conflict between non-malfeasance. Non-malfeasance to don't do harm to clients or patients. Do you get it? So there is going to be conflicting ethical principles. Such a situation, it happens a lot. That situation is what we call ethical dilemma. Do you get it? Such situation is what we call ethical dilemma. Is that okay? So that is it. As and then a practical example is the scenario. This scenario like this, it's also ethical dilemma. You see, all the two patients, they have autonomy, they have rights to health, but the nurse chose to prioritize and give the ventilator to the young man. So this situation, even though it's centering on utilitarianism, but it's also about ethical dilemma. So the nurse will be contradicting. All these patients, they have right to autonomy. They have right to proper healthcare or quality healthcare. Okay, they have right to life. Then the nurse, you also considering prioritization. So it's like two ethical standards are conflicting. That situation is what we call ethical dilemma. So sometimes you can use it. Oh, hey, Charlie, this one there is ethical dilemma. Or sometimes the next you say, hey, this one there's serious dilemma. Or Charlie, what should we do? You'll be conflicting between two ethical principles. That situation is what we call ethical dilemmas in nursing. Okay, so this brings us to the end of ethics. Is that okay? This brings us to the end of